Good afternoon. My name is Hadiza Aboki, a PhD student of the Center for Sustainable Development, University of Abuja, and this is my assignment for Research Methods and Design, SDS 902. Title of the research is Assessment of Knowledge and Attitude of Environmental Sanitation Practice Among Households in North Central region of Nigeria. Background to the study. Good hygiene and sanitation are essential in preventing diseases, improving public health, and achieving sustainable development goals, especially in developing regions like North Central Nigeria. Open defecation, improper waste disposal, and lack of hygiene education contribute to diseases. Open defecation, improper waste disposal, and lack of hygiene education contribute to disease spread, poor living conditions, and child mortality, particularly in underserved communities. It includes housing quality, clean water, food safety, drainage system, and hygiene awareness, making it a multidimensional factor in determining community health and quality of life. Household understanding, attitude, and practices around sanitation significantly influence environmental health outcomes, highlighting the need for targeted education and infrastructure. It also supports global effort to achieve sustainable development goals, especially Goal 3, good health and well-being, and Goal 6, clean water and sanitation. The problem statement. Poor knowledge and attitude towards environmental sanitation, critical sanitation issues, ineffective public health campaigns and enforcement of law, ineffective public health campaigns and enforcement of sanitation laws, socioeconomic status and access to sanitation facilities. Research objectives. The objectives of the research include to examine knowledge of environmental sanitation among households in North Central region of Nigeria, to assess the attitude towards environmental sanitation among households in the study area, to assess the practice of environmental sanitation among households in the study area, and also to find out the knowledge and attitude towards environmental sanitation among households in the study area. Research questions. The research questions include whether households have knowledge of environmental sanitation in the study area, what the attitude of households towards environmental sanitation, what is the attitude of households towards environmental sanitation in the study area, what are the practices of environmental sanitation among households in the study area, and lastly, to what extent does environmental sanitation affect the knowledge and attitude among households in the study area. Hypothesis. The hypotheses are categorized into four. One is the knowledge for environmental sanitation among households in the study is not significant. Two, the attitude towards environmental sanitation among households in the area, the attitude towards environmental sanitation among households in the study area is not significant. Three, the practice of environmental sanitation among households in the study area is not significant. And four, there is no significant relationship between knowledge and attitude towards environmental sanitation among households in the study area. Significance of the study. The study is significant towards expanding knowledge on environmental sanitation by assessing the knowledge, attitudes, and practices of households in the study area. support policymakers and NGOs in developing effective strategies and interventions to improve sanitation practices, benefit health educators and researchers by contributing valuable insight to physical and health education literature, and also enhances critical thinking and practical experience for the researcher and research assistant while providing a foundation for future academic work. Research methodology. The research methodology is, the research method is a combination of the quantitative and qualitative method, thereby making it a mixed research method. The study uses an ex post facto research design because it investigates past events and existing conditions that cannot be manipulated, especially human characteristics. This design is suitable for analyzing existing knowledge, attitude, and practices of environmental sanitation among households in north central Nigeria. It helps the researcher identify the causes of it helps the researcher identify the causes or reasons behind differences in behavior or status among groups based on natural occurring situations. Data collection and analysis, sample size and sampling techniques. 400 households samples, sample, sample size and sample techniques. The researcher sampled 400 house sample size and sample techniques. The researcher sampled 400 of households, residents, and staff of the Environmental Protection Board (EPB) in the study area. Therefore, for the purpose of this study, a multi-stage sampling procedure will be used to select the samples to be selected. Method of data analysis. Data collected from this study will be subjected to statistic. Data collected from this study will be subjected to Data collected from this study will be subjected to statistical analysis, that is Statistical Package for Social Science (SPPS) version 24, using descriptive statistics of frequencies, percentage means, standard deviation, and standard error in describing the responses of households to the various items in the questionnaire. In the test of the hypothesis postulated, one sample t-test will be used to test hypotheses 1 to 3 and Pearson product moment correlation (PPMC) for hypothesis 4. Expected outcomes. The study will enhance environmental sanitation law enforcement by supporting better monitoring, transparent penalties, and informed decision-making for policymakers and agencies. It will reveal household knowledge levels, identify information sources, expose gaps, and evaluate attitudes towards sanitation, including cultural and financial influences. The study will also explore how factors like education, income, gender, and location affect sanitation knowledge and behavior, and whether knowledge aligns with attitudes. It will uncover community beliefs, norms about sanitation, and provide tailored strategies like health campaigns and school programs to provide practices. Thank you for listening.